Hello everyone, my name is Sacha Davis, and today I'm going to be talking about why exactly we need to be federally legalizing psilocybin, or as you guys might know them as magic mushrooms, in order to utilize them as a treatment option for a variety of different health disorders. So, due to the declining nature of our current healthcare system, we need to adopt a new method of treatment that is both tried and true in its effectiveness towards treating mental health. So, according to the World Health Organization, global prevalence of both anxiety and depression have increased by a shocking 25% since the COVID outbreak in 2020. COVID has infected a large percentage of the global population with a crippling form of trauma. The current treatment options available for these disorders are not only expensive and tough to schedule, this is due to the massive wait times for therapy and medication access, but they also aren't as effective because individuals usually experience a relapse. So, an up and coming theory brought about by studies done by a group of researchers over at Johns Hopkins University proposed psilocybin as a potential cure for a whole host of mental disorders. The study exemplified drastic declines in the symptoms related to each respective disorder and improved life satisfaction ratings among these participants. Psilocybin is also a natural treatment, insinuating a dramatically decreased price standpoint opposed to its pharmacological counterpart. Now I'm going to be attaching in a separate YouTube video that's going to explain how exactly psilocybin affects your brain on a neurological and physiological level. So enjoy!
Psychedelic or magic mushrooms have been ingested by humans for over 9,000 years. Even today, this naturally grown fungus is commonly used as a recreational drug, causing hallucinations. But how exactly does it work? The main psychoactive ingredient in shrooms is called psilocybin. When ingested, the body breaks it down into the active drug psilocin, which makes its way to the brain. And here it begins to prevent the reuptake of the neurotransmitter serotonin, increasing its activity. On top of this, psilocin actually has a similar chemical structure to serotonin, meaning it can also bind to and stimulate receptors in the brain. This amplified stimulation causes you to perceive and experience things without any real stimulus, also known as hallucination. These can be of a varying nature, from visual to auditory sensations or mystical and insightful feelings. And while the experience can be quite enjoyable, some users have reported very unpleasant episodes. These feelings generally last between 3 to 8 hours, but could feel much longer as the drug alters your sense of time. Scientists have also suggested that the brain may temporarily rearrange itself by inhibiting normal brain activity and immediately creating new biologically stable brain connections. This ultimately makes it harder to determine reality from fantasy and amplifies your intensity of thought, which makes planning ahead and self-conscious thinking almost impossible. We also see activation in the hippocampus and anterior cingulate cortex, which are associated with dreaming. Finally, specific emotional regions of the brain are chemically activated, which can lead to a sense of expanding consciousness. And because the drug temporarily alters the paths in your brain, thinking outside the box becomes extremely natural. In a famous US study, 36 college-educated participants were given psilocybin and observed in a laboratory. 1/3 of the participants reported the experience as the single most spiritually significant moment in their lives, with 2/3 putting it in their top 5. 2 months after taking the drug, 79% of the participants reported increased well-being and satisfaction. Friends and family were also interviewed and agreed with these claims. But it's not all so positive. 22% of the clinically tested individuals experienced fear and paranoia at certain points during their trip. And because of the state of their brains, these typically manifested as terrifying and uncontrollable hallucinations. Though much is still unknown about shrooms, they're not considered clinically addictive and cause little toxicity to other organ systems. In fact, a UK study found that they caused the least amount of damage, both to the individual and to others, when compared to other recreational drugs. Ultimately, scientists believe that the laws need to change around clinical testing of the drug so advanced research can be executed to fully understand both the positive and negative effects that this magic fungus has on our brain.
So now that you know a little bit more about how psilocybin affects our brain, I wanted to talk a little bit more about the different doses that it's typically given. So usually it's either given in one of two ways. So the first being as a microdose. So this is anywhere from zero point 0.1 to zero point 0.3 grams. So when you typically see someone, when you think of shrooms, you probably think of, someone that's in a whole other world. They have these hallucinations, they're not really themselves. That is typically brought about by something known as a heroic dose. So the heroic dose, instead of microdosing where it's zero point 0.1 to zero point 0.3, this is 3 or more grams. So it's typically that microdosing is going to be taken every day and that you're going to see effects slowly over time. Whereas a heroic dose, for lack of a better term, is going to hit you like a brick. Basically, heroic doses are typically accompanied by, like I mentioned, a strong and impactful visual and auditory experience that's composed of hallucinations, and they totally transform and distort one's reality. So, after one experiences one of these strong psychological changes brought about by ingesting a heroic dose of psilocybin, current studies actually show that these changes will persist over the long term, thus offering assistance to those battling chronic mental disorders. Psychedelics provide a mystical experience in that they often shift a person's mindset or belief system, enacting a behavioral shift following the trip. Furthermore, when taken in tandem with therapy, they enable people to become more suggestible and more responsive to the positive suggestions that are made by a therapist. Talk therapy is naturally altered to aid each respective mental disorder and able to ensure the patient gets the specific care that they require and meet their intended goals. So, as you can imagine, talk therapy in tandem with taking this strong dose of psilocybin really allows a person to open up and really get to that deep headspace where all of their trauma is coming from, to then open up to their therapist. So now I really want to jump ship from talking about how exactly psilocybin, impacts our brain to talking about the legal state of psilocybin. So despite the promising effects that psilocybin is sought to evoke, like I have mentioned, the US 1971 Controlled Substance Act was passed, and this designated psilocybin alongside other well-known drugs to become illegal to ingest. Psilocybin is currently classified as a Schedule 1 drug, which means that obtaining the drug, having the drug, and using the drug are all criminal offenses. So, with the growing bias against ingesting psilocybin, this has caused American civilization to be bombarded with negative information about its effects, and that's kind of where we get this mantra of don't do drugs. So, of course, the next question is how do we change this? Since the United States is run as a democracy, the voting power that we hold is substantial. With civic engagement in mind with the course, not only does research regarding psilocybin's effectiveness need to be brought to a large scale awareness among the public, but we need to come together as Americans to lobby getting the legalization of psilocybin passed. Reflecting back onto the year 2000, the citizens of Colorado came together to lobby passing a bill that legalized using marijuana medically within the state. After persistence and hard work for getting this amendment on the ballot, voters were able to pass ballot Amendment 20 that then legalized medical marijuana. Then, over a decade later, in 2012, Colorado voters were able to not only get a second amendment regarding the legalization of marijuana on the ballot, but we were also able to come together in voting to pass Amendment number 64 that legalized recreational marijuana. This example specifically reveals how we can all come together as citizens to counteract prior bills that have been passed, as in the case with the Controlled Substance Act, to not only get an amendment on the federal ballot, but have it passed so that it's implemented in a permanent manner. So now, for the last part of this video, I wanted to touch briefly upon a couple different disorders that psilocybin is really being aimed currently to treat. So, depression reigns at the top of the list. Globally, roughly 280 million people, crazy number, are diagnosed with depression. Those battling with this disorder are left at the mercy of antidepressants and therapy to help, lift themselves out of a depressed mood. However, these treatment options are not always effective and leave individuals feeling more hopeless than ever. So, to help combat this baffling statistic, psilocybin has been examined, specifically at Johns Hopkins, on its effects in treating depression. Using a small sample of adults with diagnosed depression, the researchers over at Johns Hopkins reported how 2 doses of the psychedelic substance, given with supportive psychotherapy, so talk therapy, produced rapid and large reductions in depressive symptoms, with most of the participants showing improvement and half of the study participants achieving remissions through the 4-week follow-up period. So specifically, researchers reported how 67% showed a more than 50% reduction in depression symptoms at the 1-week follow-up and 71% at the 4-week follow-up. Overall, 4 weeks post-treatment, 54% of the participants were considered in remission, meaning that they were no longer qualified as even being depressed, which is awesome. So, now moving on from talking about depression, I really wanted to talk about post traumatic stress disorder or PTSD. So, it's estimated that 6% of the adult population is affected with post traumatic stress disorder. In regard to treatment, current methods in place to treat post traumatic stress disorder range from therapy to antidepressants and to antipsychotics. However, despite their ability to kind of numb the majority of the strong emotions and trauma that's linked to PTSD, these methods often fall short. So, in a 2013 research study conducted over at the University of South Florida, animal studies actually showed that psilocybin stimulated nerve cell regrowth in the parts of the brain that were primary contributors to the functions of both emotion and memory. So, this study mainly revolves around how psilocybin has the capability to stimulate neurogenesis, which insinuates the growth and repair of brain cells within the hippocampus. So, the last mental disorder that I wanted to talk about that psilocybin aims to treat is anxiety. In America alone, I'm not even going to go global with it, guys, 40 million people are battling anxiety. There was a study completed that was a double blind, placebo controlled study that focused on the efficacy and reliability of psilocybin for treating anxiety based disorders. This study utilized 12 patients that were diagnosed with either acute stress disorder, generalized anxiety disorder due to cancer, or adjustment disorder with anxiety. So the patients were divided into two groups in which they either took niacin, which was the control, or psilocybin. So patients remained with the staff for 6 hours and were constantly monitored through psychological evaluations and vitals. The results showed that anxiety significantly decreased at 1 and 3 month post treatment in the psilocybin group compared to niacin. Mood also improved for 2 weeks after treatment and reached statistical significance on the Beck Depression Inventory at the 6 month point with the same comparison. So, overall, I really hope that this video helped to illuminate why we need to completely reinvent the ways that we approach the treatment for the top mental disorders that the population is currently battling. Psychedelics, predominantly psilocybin, is a powerful and transformative substance that has a multitude of positive impacts on both physiological and neuronal functioning within the human body. So, thank you guys so much for watching this video, and I hope you enjoyed. Thank you.